Hello everybody, I am Dr. Chitra and I am the Medical Director of the Eye Foundation Group of Hospitals. So I am just going to give you a very brief insight into what is refractive surgery. Now, basically all of us are wearing glasses, minus part glasses or plus part glasses, and after the age of 18, and if your refraction is stable, then you could get rid of these glasses so that you can see without glasses, correcting you of glasses or need for contact lenses. What surgery are you going to advise a particular patient? The earlier options were where a manual microkeratome was used to create the flap, to do the power correction, and then came the femtosecond laser, and then further on to contour Lasik, and then further on to smile. So, but then what is the criteria to decide which procedure a patient would undergo? So, when a patient comes to you interested in getting a laser vision correction done, then you first check the vision and do the refraction. Based on the refraction, you understand that what are the possibilities. Then they need to undergo a detailed eye evaluation where you do a topography, or that means you're doing a scan of the cornea, and that gives us a hell of a lot of information, but specific to make it simple and understand. It'll tell you that your cornea is normal, it's not a diseased cornea, and if it is a normal cornea, then we advise based on the corneal thickness and the other parameters, we advise with femtosecond laser. It's not a crude cutting, it's a very precise femtosecond laser is used to create the flap. So if the cornea is less than 490, either create a femto-Lasik flap and do a contour vision, or you can do a smile procedure. So contour vision is a topo guided procedure, which again which has its role for the range of minus par. In smile, it's just a small 3 mm incision is made again on the femtosecond laser platform, and the laser passes and fashions a lenticule inside the eye. And the shape of the lenticule and the thickness of the lenticule decides what is based on the power of the eye which is being corrected, and that lenticule is removed through a small 3 mm incision. The patient is just minimally uncomfortable and fine the very next day, fine to get back to work and everything. So basically, a smile is a very popular procedure and it's doing phenomenally well. And the other contour procedure, in our setup, what we do is we give them the option of the two, but contour, yes, it is a precise, wonderful procedure, but a flap is created in this procedure. And when the patients have high cylinders and high sphere and cylindrical power, where the cylindrical power is significantly higher, we give them an option that why don't you go for a contour vision, unless the patient has read on the social media, is keen on getting either smile or contour. We explain the need for each of these options, which are similar mostly but a little dissimilar, and they can get it done. Supposing the cornea is thin, supposing the power is high, minus 10, 11, 12, then you can't do a surface ablation. And I told you that on cornea, you can't do femtolaser for more than a minus 8 or 9 diopters. We have wonderful options. So why would you beat the cornea with so much of excimer laser? So then you can go on to doing a phakic IOL. A phakic IOL is make just a 3 mm incision, and these a lot of detailed measurements are taken, which are not very difficult, and based on the measurements specific to the eye and tailor-made to the eye, the lenses are ordered. These are 100 micron thin lenses, very thin lenses, which are inserted into the eye, and it can be done both eyes in the same day. Even Lasik can be done both eyes in the same day. It's done, and patient with a minus 10, 11, 15, they walk off with a correction and they do brilliantly well. Now, I said you can do above the age of 18, but there are people at the age of 30 who are nearing 40 who have an established family, and now they have a little money to spend on themselves, and they are eager to get rid of glasses. Even for them, of course we need to identify that they don't have cataract. So you won't go to that age group, that 30s and early 40s and a little late 40s. They're interested in getting rid of glasses, then we can do either a monovision, that is correct one eye full for distance and leave a little minus bar in the other eye, which will allow him to read. So that was one way of addressing it. Or we have those presbyopic phakic ICLs, which are available, ICLs or IPCL. We have the important variant, we have the Indian variants, which are also doing very well. And this again, as I described earlier, needs just a 3 millimeter incision slipped into the eye, and the patient finds himself comfortable doing distance, near and intermediate and near vision. So refractive surgery is a brilliant option for thinner cornea, thicker corneas, patient in the age of 18, 20s, 30s, so 40s, early 40s. So, there's a wide range, and the visual freedom to get rid of glasses, to see fine without glasses is an amazing thing. Thank you.